Hi everyone, this is JP Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, today it's our session number 6 for Image Spotter series. This series is targeting upcoming exam NEETPG FMGE which are going to held in month of May and June year 2022, and it is also targeting exam INICET for year 2022. Till now, month and date for INICET is not announced, but we are covering images for every exam, whether it is NEET PG, FMG, and INICET. Till now, we have covered 5 sessions for Image Spotter series, and I hope you are consistent with this series because these images are going to play an important role in your preparation. These images have an important role for your every upcoming exam, whether it is NEET PG, FMG, or INICET, because images are important part for every exam. So, my dear friends, we have another series also going on, that is super 1000 question series, and if you are consistent with both of these series, then you are going to get good grades, or you are going to score a good grades in your upcoming exam, because in this series we are covering image. In super 1000 question series we are covering every type of question, whether it is clinical based, image based, or previous year question. We are practicing every type of questions. It also include one liner questions also. Okay, so my dear friends, let's start our today's session, and in our today's session we are going to practice some of the images for anatomy, and it will rotate around wrist of your hand. Okay, so let's start our session, and my dear friends, our next session will be on Thursday, and that will be super 1000 question session. Okay, so let's start. Here we go for our first image. So here you have to spot proper diagnosis. Here you have to spot this red area. What is this red area? So I am giving you one hint. You have to spot here muscle name. Which muscle is this red highlighted area? So my dear friends, name of this muscle is palmar brevis. Name of this muscle is palmar brevis. I think you all are well clear with this image. My dear friends, first we will practice some of the image, and then in end we will discuss muscle according to compartment of hand. Okay, we will discuss their proximal, distal insertion, and innervations and their actions. Okay, so we are going to discuss four things for every muscle according to compartment, that is distal and proximal insertion, innervation, and action. Okay, so let's go for our second image. Here we go for our second image. So my dear friends, it's our second image, and you have to spot here three things. Okay, first you have to spot here upper one. Okay, this area, and then this area within the metacarpals. Okay, and then this area within the phalanges. Okay, so my dear friends, here I am giving you 30 seconds. So here your answer will be lumbricals. Okay, here you can see this structure is flexor digitorum profundus, and this red area here, this red area is highlighting lumbricals. Okay, this area is highlighting lumbricals. I think it is clear to you all, my dear friends. And this below one is highlighting proximal phalanges. So second image is also clear. Okay, let's go to our third image. Here we go. So my dear friends, it's our third image for the day, and here you have to spot four muscles. Okay, and 20 seconds for you. So my dear friends, correct spotted muscles will be this top one will be adductor pollicis muscle, then this just below that will be flexor pollicis brevis, this external will be openness pollicis muscle, and this middle one will be abductor pollicis brevis, and here it is flexor retinaculum. This one is tubercle of scaphoid. Okay, so I think third image is also clear to you all. Let's go for our fourth image for the day, and here we go. So my dear friends, it's our fourth image for the day, and here you have to spot correct bones. Okay, and I am giving you 25 seconds. So my dear friends, now let's go by one. Okay, this first one will be hook of hamate. Then this one will be hamate. Okay, this third one will be, it will be pisiform. Just below this pisiform, this area will be, it will be triquetral. Okay, just below triquetral it will be lunate. Okay, and this tip will be ulnar styloid. This tip will be ulnar styloid. Okay, and this is head of ulna. So this side is covered. Now let's go for this side. So this top one will be here. This one will be, it will be capitate. Below the capitate, here you go for second one. This second one will be trapezoid. Below this trapezoid, this structure will be trapezium. Below trapezium, this structure will be scaphoid. And this is last part for this image. Last bone will be radial styloid. So I think this image is clear to you all. Now I am providing you proper image. Okay, just wait for few seconds more. I will provide you proper image, labeled image, and here you go for the image. So it is labeled image. Here you can see complete set of bones present in this portion of your hand. Okay, in wrist area. So my dear friends, four images are spotted correctly in very crystal cleared pattern. Now let's go for our fifth image, and here we, so it's our fifth image for the day, and here you have to spot some marked locations. Okay, in this image you have these four locations. This fifth one is trapezium. Okay, and these two are same with first one, and here you have to spot three, total eight. So I am giving you 40 seconds. So my dear friends, this first one will be, this is adductor pollicis transverse head. Okay, just below this, here you can see this one, it is uh, adductor pollicis oblique head. Okay, in this image here you can see both the structure which I named. Okay, this first one is uh, adductor pollicis transverse head, and this below one will be, this one will be adductor pollicis oblique head. Here you go for third location. This third locations will be in between, it will be abductor pollicis. Okay, just below, just in the outer area, here you can highlight it. Okay, from yellow I will go, this outer one will be, it is openness pollicis. Okay, and this below one is transverse trapezium. Okay, I already told you. And here you go for this image, and this is done. Now we have to tell these three below location, and these are, this interior will be, it will be ulnar head. Okay, just this is ulnar head. Here you go, and 1 minute, I'm highlighting by another color. I will choose black color. This outer side, this third structure will be flexor pollicis brevis, and this middle one will be, this between one will be, this will be radial head. Okay, so 1 minute, I will highlight this image again for you. I will provide you well labeled image now. Here it will clear all your doubts. Okay, if here you not get proper answer, so let's get correct answer for you, my dear friends. Here you go for correct answer. So I think every location is well labeled here. you are well clear. I'm giving you 10 seconds for seeing all locations correctly. You can pause your video here. My dear friends, if you feel that this session is helpful, then you have to like this session, share this session, and subscribe to my channel for more updates. So let's go for our next image. We have covered 5 images till now, and I hope that you are enjoying this session. This is 6 images for the day, and here you have to spot 5 things, 5 locations properly. Okay, so my dear friends, this first location, this first thing, this is median nerve, a major nerve that carries messages between hand and brain. मीडियन नर्व का काम क्या है? मैसेज को कैरी करना ब्रेन और हाथ के बीच में, ठीक है। इसके नीचे वाली जो सेकंड स्ट्रक्चर है हमारी, इसका नाम है फ्लेक्सर टेंडन्स। ये टेंडन्स क्या करते हैं? मसल्स को बोन के साथ क्या करते हैं? कनेक्ट करते हैं, ठीक है। जैसे फिंगर मूव करती है तो उसके साइड और बैक में जो आ रहे हैं वो क्या है? फ्लेक्सर टेंडन। एंड दिस हियर थर्ड लोकेशन फॉर यू, दिस थर्ड लोकेशन इज ट्रांसवर्स कार्पल लिगामेंट. It is a tough ligament. क्या है? टफ लिगामेंट है that lies across the arc of carpal bones and form the roof of carpal tunnel. ओके, ये जो रूफ जो बन रही है कार्पल टनल की, ये बनाने वाला कौन सा लिगामेंट है? ट्रांसवर्स कार्पल लिगामेंट। ओके, अब ये जो इससे अगली जो स्ट्रक्चर है हमारी, 1 मिनट, आई नीड टू क्लियर दिस है। सो स्ट्रक्चर नंबर जो 4 हमारी है वो क्या है भाई? हाईलाइट क्या किया है आपने इसका आंसर होगा टेंडन शीथ। इट इज अ प्रोटेक्टिव आउटर कवरिंग दैट लेट्स द टेंडन मूव इजीली। टेंडन की मूवमेंट के लिए जो नेसेसरी है वो क्या है? टेंडन शीथ। उसके बाद में जो नीचे जो एरिया आया है, दिस फिफ्थ एरिया हेयर, दिस एरिया, my dear friends, this area, it is carpal bones. It is U-shaped. Okay, you can see it is U-shaped group of bones at the base of palm, and these bones form the hard floor for side of carpal tunnels. So I think, my dear friends, this image is also clear to you. Now I am providing you here clear image with well labeling, and here you go, I am providing you the labeling. So let's see. Okay, you can see correct explanation, correct labeling for the image. Here we go for our next image, 7th image for the day. My dear friends, here you have to spot nerves. What you have to spot in this image? Nerves, and I am giving you 20 seconds for the image. So my dear friends, this top one will be, this nerve will be median nerve. Okay, here you can see both view for the hand. Okay, so this nerve, top one is median nerve. Okay, here you can see this nerve. This nerve is superficial branch of radial nerve. Okay, in this area you can see it is ulnar nerve. Okay, on both sides the nerves are explained now, are crystal clear to you. Here you go for correct image, labeled image. So 7 images are done for the day, and I think you all are enjoying this session till now, because we have to now learn about muscles also, some of the important muscles which we have seen in images till now. Now we have to discuss their distal and proximal insertion, then innervation, and then their action. Okay, according to compartment. Here we go for our next image. So 8th image for the day. My dear friends, you have to spot 8 location this side and 10 location this sides. It can include ligaments, muscles. Okay, mostly here all are muscles. Okay, so this top one will be here, this side, this first location will be flexor digitorum profundus muscle tendon. Okay, second one will be, this will be lumbricals muscles, which we have already seen in image, in between metacarpals. Third one will be flexor digitorum superficialis muscle tendon. Okay, fourth one will be this structure here. I think I need not to highlight this, but I'm going you by location. So this one will flexor digit minimi brevis. Okay, this one will be abductor digit minimi muscle. This one will be openness digit minimi muscles, and here this location is flexor retinaculum or transverse carpal ligament, and here these four highlighted structures are flexor digitorum superficialis tendon. From this side we go from below one. Okay, this below one will be flexor carpi radialis tendon, then this one will be flexor pollicis longus tendon. Above this, opnes pollicis muscle. Above this, you can see abductor pollicis brevis muscle. Above this, you can see flexor pollicis brevis muscle. Above this, you can see adductor pollicis muscle oblique head. We have seen this previously, my dear friends. So means we are covering concept in a series. Okay, and if you are regular till now, it will help you a lot. This one will be adductor pollicis muscle transverse head. This one is transverse head, this one is oblique head. oblique ये है transverse. ठीक है, ये जो है यहाँ का जो फिफ्थ ऊपर का टॉप लोकेशन है, ये क्या है, फ्लेक्सर पोलिसिस लॉन्गुस टेंडन. एंड दिस वन फाइनल वन एंड लास्ट वन फॉर दिस इमेज इज फर्स्ट डोर्सल इंट्रोसियस मसल. So I think this image is clear to you all. Now I think you all wanted to see clear images with proper labeling. So here you get this proper labeled image. So I think answer for this image is clear to you all, my dear friends. I am marking this image. Okay, so this image is well marked here. You can see well marked image here. Okay, my dear friends. So eighth image for the day is also done. Let's go for our next image. Here you go, bonus for the day. Okay, this is end of images, and after this we will discuss muscles with little bit detail. Okay, top one you can see here phalanges, distal, middle, proximal head. These are metacarpals. Okay, and here these are bones, these are carpals. Okay, carpals means wrist area, hamate, pisiform, triquetrium, lunate, and this side trapezium, trapezoid, scaphoid, capitate, and this one is radius. Here this one is ulna. You have to solve 100 MCQ every day. You have to devote 9 to 10 hours every day. 1 GT in 1 week. Analyze on same day. Avoid laziness. Laziness को अवॉइड करने का पैटर्न था, अपनी फैमिली के साथ टाइम स्पेंड कीजिए. कुछ जब लेजीनेस फील हो तब कुछ कर लीजिए, कुछ इंटीरियर आउटडोर कुछ गेम खेल लीजिए या फिर फैमिली के साथ टाइम स्पेंड कीजिए. अर्ली इन द डे रीड वन इम्पोर्टेंट टॉपिक. अभी से क्या स्टार्ट करना है, क्योंकि टाइम इतना ही बचा है कि हर रोज हमें क्या है, अपना जो सुबह का ये जो इम्पोर्टेंट फेज होता है, जो सबसे जिस टाइम में ब्रेन सबसे एक्टिवली वर्क करता है, उस टाइम में हमें क्या करना है, हर रोज डे के स्टार्ट में हमें एक इम्पोर्टेंट टॉपिक को क्या करना है, रिवाइज करना है. और हमारे पास अब इतने दिन हैं कि हम जो सबसे इम्पोर्टेंट हाईलाइटेड टॉपिक है उनको अर्ली इन द मॉर्निंग खत्म करते जाएंगे, रिवाइज करते जाएंगे. तो इसका एक बेनिफिट जो है आपको कब देखने को मिलेगा, एग्जाम टाइम में, कि यस what I have done in early morning, that is showing its positive effect now. So you have to keep yourself in relax mode. You have to stay positive. You have to believe in yourself. In this phase of time, just don't be weak in yourself, because it is very important time for you all. Now, my dear friends, we are going to discuss muscles with their innervations. Okay, according to their compartment. Here you can see compartments are highlighted. Central compartment, this one is central compartment, then this one is thinner compartment, adductor compartment. In between this green one is thinner space, this is mid planar space, hypothinner compartment. Okay, this one, here you can see, here areas are also highlighted, thinner fascia, thinner space. Okay, this space is palmar aponeurosis, hypothenor fascia, mid palmar space. Now let's see the muscles with innervation, insertion and actions. So my dear friends, now we will discuss muscles, their insertion, innervation and actions according to different compartments. I hope that you are enjoying this session till now, and in within 8 to 10 minutes this session will end. So just be with me, because this session is going to helpful for you for your upcoming exam. It will help you a lot in your preparation, in revising the muscles. In thinner compartment, here we have three muscles: abductor pollicis brevis, flexor pollicis brevis and opnes pollicis. Okay, and in flexor pollicis brevis, it have proximal insertion, that is flexor retinaculum, and tubercle of scaphoid and trapezium. And now we go for distal insertion for abductor pollicis brevis and for flexor pollicis brevis. The insertion is distal insertion is same. It is lateral base of proximal phalanx of thumb. And for opnes pollicis, it will be lateral side of shaft of first metacarpal. Okay, innervation for these three muscle will be: for abductor pollicis brevis, it will be recurrent branch of median nerve. Okay, for flexor pollicis, it will be superficial head and deep head. Superficial head, recurrent branch of median nerve. Deep head for deep branch of ulnar nerve. Okay, opnes pollicis will have innervation for recurrent branch of median nerve. So for two muscle, the innervation is same here for abductor and opnes. Okay, what are actions for these three muscles? For abductor pollicis, it will abduct thumb and assist in apposition. For flexor, it will be flexes the thumb. Okay, for openness, it will oppose the thumb. Okay, so I think thinner compartment muscles are clear to you all. Let's go for our next compartment. So next compartment is adductor compartment, and here it have one muscle, that is adductor pollicis. What are proximal insertion for this muscle? It have oblique head for base of second and third metacarpal, capitate transverse head, and anterior shaft of third metacarpal. What is distal insertion? That will be medial base of proximal phalanx of thumb. And innervation will be deep branch of ulnar nerve. Action will be adducts thumb. So you can make this table with me, my dear friends, according to compartment in one single page. And in end, what you have to do, you have to see that what thing is common where. By this you can link up all things, and you can retain these things for long period of time. Okay, so it is second compartment. Just keep drawing in your copybook according to compartment in one single page. Okay, let's go for our third compartment. Here it is hypothenar compartment, and here it have three muscles. What are these three muscles? Abductor digiti minimi, flexor digiti minimi brevis, openness digiti minimi. Proximal inner insertion क्या है इन तीनों मसल्स की? पहली मसल की है pisiform, दूसरी मसल्स की है हुक ऑफ हेमेट एंड फ्लेक्सर रेटिनाकुलम, तीसरी में है हुक ऑफ हेमेट एंड फ्लेक्सर रेटिनाकुलम. सो दोनों मसल्स, यहाँ पर दो मसल्स है, फ्लेक्सर डिजिटाई और ओपनस डिजिटाई. इन दोनों की जो प्रोक्सिमल इंसर्शन है वो क्या है? सेम है. अब डिस्टल में किसकी सेम है भाई? डिस्टल में है एबडक्टर की और फ्लेक्सस की. बेस ऑफ प्रोक्सिमल फैलिंग्स ऑफ लिटल फिंगर ये सेम है. लेकिन ओपनस डिजिटाई मिनिमाई की डिस्टल इंसर्शन क्या है? फिफ्थ मेटाकार्पल. और इन तीनों की इनर्वेशन क्या है? डीप ब्रांच ऑफ अल्नर नर्व. ओके, डीप ब्रांच ऑफ अल्नर नर्व. एक्शन क्या है तीनों का? एबडक्टर डिजिटाई का एक्शन है एबडक्ट्स फिफ्थ डिजिट, फ्लेक्सर डिजिटाई का एक्शन है फ्लेक्सिस फिफ्थ डिजिट, एंड ओपनस डिजिटाई का एक्शन है अपोजिस फिफ्थ डिजिट. ओके, सो आई थिंक थर्ड कंपार्टमेंट इज आल्सो क्लियर टू यू ऑल. सबको समझ आ रहा है? ठीक है, सब इसको ड्रॉ करते चले अकॉर्डिंग टू कंपार्टमेंट in one single page or in two page, whatever you feel, but you have to remember these things. Okay, you have to remember actions, especially you have to remember innervation and name of muscle. Okay, जितना proximal और distal insertion important नहीं है, उतना innervation important है. ठीक है, मसल्स की लोकेशन बड़ी इंपॉर्टेंट है, कौन सी बोन रिस्ट में है, ठीक है, और कौन सी बोन की लोकेशन कहाँ कहाँ है, यह आपको एक्यूरेटली पता होना चाहिए. ठीक है, रेडियल नर्व या मीडियन नर्व, इससे रिलेटेड भी एक क्वेश्चन आया था रेडियल नर्व का, पिछले एग्जाम जो हमारा एफएमजी का हुआ था उसमें भी था और शायद में नीट पीजी में भी था. So if you are practicing PYQs or not practicing, then my sessions are also available. I am covering PYQs in my sessions also. Okay, you can watch Super 1000 question series and quiz bank. It is full of questions. You can watch questions there. You can practice questions. Here we go for our next compartment. It is superficial to hypothenor compartment. This compartment had one muscle, palmaris brevis muscle. फर्स्ट इमेज फॉर द डे इसी मसल की थी ना, फर्स्ट इमेज पामारिस ब्रेविस मसल की. इसकी प्रोक्सिमल इंसर्शन क्या है, वो क्या है, पामर एपोन्यूरोसिस. इसका डिस्टल इंसर्शन क्या है, डर्मिस ऑफ द स्किन ऑफ हाइपोथिनर एमिनेंस. कहाँ से जा रही है, सुपरफिशियल से हाइपोथिनर की तरफ जा रही है. ठीक है, इसलिए इसका डिस्टल इंसर्शन क्या है, डर्मिस ऑफ स्किन ऑफ हाइपोथिनर एमिनेंस. इसका इनर्वेशन क्या है, सुपरफिशियल ब्रांच ऑफ अल्नर नर्व. एक्शन क्या है, रिंकल्स स्किन ऑफ हाइपोथिनर एमिनेंस. लंब्रिकल्स जो मसल प्रेजेंट है किसके बीच में, मेटाकार्पल्स के बीच में. अब इसका प्रोक्सिमल इंसर्शन क्या है, टेंडन ऑफ फ्लेक्सर डिजिटोरम प्रोफंडस. ओके, डिस्टल इंसर्शन क्या है, लेटरल साइड ऑफ एक्सटेंसर एक्सपेंशन ऑफ सेकंड टू फिफ्थ डिजिट. ओके, इनर्वेशन क्या है, फर्स्ट सेकंड मीडियन नर्व, थर्ड फोर्थ डीप ब्रांच ऑफ अल्नर नर्व. क्लियर हुआ. एक्शंस क्या है इस लंब्रिकल्स के, इन लंब्रिकल मसल्स के, वो क्या है, फ्लेक्स मेटाकार्पल phalangeal joint एंड एक्सटेंड इंटरफेलेंजियल joints. क्लियर हुआ. नाउ लेट्स गो फॉर आवर अनदर कंपार्टमेंट. हियर वी गो फॉर इंट्रोसियस कंपार्टमेंट. ओके, here you can see the muscle present, that is dorsal introsi. ये एक मसल नहीं है, कुछ मसल्स, तीन मसल्स आगे भी हैं. ठीक है, तो इंट्रोसाई, डोर्सल इंट्रोसाई. इसका प्रोक्सिमल इंसर्शन क्या है, एडजेसेंट साइड ऑफ मेटाकार्पल. मेटाकार्पल की जो एडजेसेंट साइड्स है उनके अंदर किसका इंसर्शन है, कौन सी मसल्स हैं, डोर्सल इंट्रोसाई. डिस्टल में कौन सी है, बेसिस ऑफ प्रोक्सिमल phalanges and extensor expansion of digits 2 to 4. ओके, सो माय डियर फ्रेंड्स, एक इमेज थी जिसमें मैंने ये सब मसल्स हाईलाइट कर रखी है. ठीक है, सब मसल्स है उसमें. ठीक है, उसमें कंपार्टमेंट मेंशन नहीं है लेकिन सब मसल्स है. यू कैन सी दैट इमेज. और इसका एक्शन क्या है भाई, एक्शन है इसका abduct digits, help flex metacarpophalangeal joint and extend interphalangeal joints. ये इसके एक्शन है. अगली मसल्स क्या है, here we go for palmar introsi. तीन बोली थी ना मैंने, तीन है ये. और इसमें प्रोक्सिमल इंसर्शन क्या है भाई, फर्स्ट पामर इंट्रोसियस मीडियल पार्ट ऑफ सेकंड मेटाकार्पल, सेकंड पामर इंट्रोसियस एंड देन लेटरल पार्ट फॉर फोर्थ मेटाकार्पल, थर्ड पामर इंट्रोसियस. इसका क्या काम होगा, लेटरल पार्ट ऑफ फिफ्थ मेटाकार्पल. तो इनकी कितनी इंसर्शन है भाई, तीन तीन इंसर्शन है. अब ठीक है, और इन इंसर्शन में देखो, डिस्टल इंसर्शन में क्या है, फर्स्ट पामर इंट्रोसियस, इसमें क्या है, मीडियल पार्ट ऑफ सेकंड प्रोक्सिमल फैलिंक्स. सेकंड एंड थर्ड पामर इंट्रोसाई, इसमें क्या होगा, लेटरल पार्ट ऑफ फोर्थ एंड फिफ्थ प्रोक्सिमल फैलेंजेस. ऑल पामर इंट्रोसाई, इसका क्या होगा, इंसर्शन एक्सटेंसर एक्सपेंसर ऑफ डिजिट 2, 4 एंड 5. सो इसके प्रोक्सिमल और डिस्टल इंसर्शन भी हो गए. ठीक है, पामर इंट्रोसाई, इनके तीन तीन क्या है, डिस्टल और प्रोक्सिमल इंसर्शन है, क्योंकि ये तीन तीन मसल्स है, तीन ग्रुप है. ठीक है, इनर्वेशन क्या है, डीप ब्रांच ऑफ अल्नर नर्व. सो ये जो मसल है इंट्रोसियस कंपार्टमेंट की, इनकी इनर्वेशन क्या है, डीप ब्रांच ऑफ अल्नर नर्व. एक्शन क्या है, abduct digits, help flexo metacarpal phalangeal joints, and extend interphalangeal joints. So my dear friends, this is our session for the day. Okay, we started with image and we are ending with discussion of. So this is end for this session, my dear friends. First we have spotted 8 images. We have spotted different bones present in the wrist, then muscles, okay, then tendons, then nerve. So means today we have discussed many important things regarding our hand, our wrist, okay, and we have discussed all the muscles according to compartment. ओके कौन से कंपार्टमेंट में कौन सी मसल्स प्रेजेंट है, ठीक है, और उन मसल्स का हमने क्या किया, डिस्टल और प्रोक्सिमल इंसर्शन डिस्कस किया, इनर्वेशन डिस्कस किया, एक्शन डिस्कस किया. सो आई थिंक यू हैव मेड अ सिंपल चार्ट एंड नाउ यू कैन पिक अप कॉमन थिंग्स कि ये मसल कौन सी मसल के साथ इसका एक्शन मिल रहा है, कौन सा इनर्वेशन कहाँ मैच हो रहा है. यू कैन रिमेंबर इट, यू कैन रिटेन इट फॉर लॉन्ग टाइम इफ you have made chart now. Okay, and all images are well clear to you. I can hope this only, and I think that you are following, I am hoping that you are following day schedule for your preparation, that you are solving 100 MCQ every day, you are also giving GT, you are analyzing GT in one day, you are positive in yourself, you are avoiding laziness, you are working in consistent pattern of preparation. And if you are consistent with this image session and with super 1000 question series, then it is going to be a very great thing for your preparation, because it will help you a lot to get good grades, to get good uh, preparation, or you can say you will feel like yes, I am done, means I am doing great and great every day. These sessions will surely help you to improve your scores in your GTs, then your in your upcoming exam. So thanks to everyone, stay safe, stay healthy. If you feel that this session is helpful, then do share and like this session. Also subscribe to my channel for more updates, and don't forget to press on notification bell icon.